Hello, I'm Dr. Brian Gibson, and the idea is you also want to take the second step. The second step is to manage peripheral neuropathy. And the idea with managing your peripheral neuropathy, especially the peripheral neuropathy symptoms, is basically determining what those symptoms are. What are the most important symptoms you need to treat? And the idea that we treat peripheral neuropathy symptoms in four ways. Four ways. Number one is you can actually do nerve repression. This is the most common. Most of the medications that you will take, even narcotic pain medications, they're all designed to repress the symptoms. Ways that you can repress peripheral neuropathy symptoms include nerve modifying medications, narcotic or other pain type medications, CBD oil, TENS units, different machines that are basically designed to stop the pain. There are also some techniques that you can actually learn to repress it through mental exercises, brain exercises, meditation, even some types of exercise will cause a repression of the nerve symptoms. Number two is nerve reeducation. This is an important piece of the puzzle because what we can do is we can actually take pain, that's the main symptom of peripheral neuropathy a lot of times, and you can actually stop it because basically what you're doing is you're teaching the nerve and the brain to communicate correctly. So thing to remember is peripheral neuropathy is a malfunction of the nerve, not a stopping of the nerve. So the nerve is not working like it's supposed to, and because of that, you're actually getting simple sensations misinterpreted. They may be a touch that's causing pain. It may be a sheet that's uncomfortable or whatever the situation is. And so the idea is what we want to do is help you manage those symptoms by giving you a process, an electrical stimulation through those nerves to teach them to communicate correctly. There's two machines that actually do reeducation. One is called the Rebuilder, and the other is actually called Calmare. And in both cases, what they're doing is teaching the nerve and the brain to communicate correctly, and in most cases can improve the symptoms significantly. Number three is nerve reset. So just like you can take a computer when it's not working like it's supposed to, and you call support and they say, shut your computer off, turn it back on and see if it works. You can do the same thing for nerves. If you can shut a nerve off and turn it back on, sometimes you'll fix that slow nerve or that weak nerve and actually get it to start functioning like it's supposed to. This is done through sending an electrical current through the nerve that depolarizes it, then repolarizes it so that it can actually function like it's supposed to. The best machine we've found to do that is called Neurogenics. And the fourth treatment, the fourth option for treating or managing the symptoms of peripheral neuropathy is called nerve repair. And there is a wide range of things we can do for nerve repair. The point is, this is the most important. It's also the slowest. And so a lot of times we use some of these other techniques to help you manage the symptoms short term while we work on repairing the nerve and getting the nerves to function like they're supposed to. This includes everything from the way you're eating, to the vitamins you're taking, to exercise you're doing, to certain types of machine like the MLS laser, all situations where you can actually repair the nerve. So when you're trying to manage your peripheral neuropathy, you need to remember those four: that you can repress the pain, you can re-educate the nerve so it fixes the pain or the symptoms. I guess it shouldn't be just pain, but any symptoms. You can reset the nerve so it fixes the symptoms, and you can repair the nerve so you're reversing the symptoms, at least short term. And as long as you repair the nerves, you could actually get a period of time at least where you have a significant improvement. This is Dr. Brian Gibson. Hopefully that is helpful. Hopefully that helps you figure out the direction you want to go and some of the options you have.